Rinder pest, cattle plague. This word is derived from German word mean plague. It is also called as pest of bovine, bovine typhus, and in India it is called as martyr. A highly contagious disease characterized by 1. High fever, 2. Ulcerative stomatitis and esophagitis, 3. Haemorhagic enterocolitis, 4. Diarrhoea, 5. Massive necrosis in lymphocytes of Peyer's patches, lymph nodes and spleen, 6. Dehydration and death. Etiology of the disease. It is caused by Rinder Pest virus of genus Morbillivirus of PARAMYXOVIRIDAE. There are 3 lineages, 1 and 2 in Africa and 3 is Asia originated, but there is little difference between them. It is a single-stranded RNA virus related to PPR in goats, canine distemper in dogs and measles in humans. Epidemiology. Historically it was a devastating disease of cattle in Asia to Europe, the Middle East and Africa, usually as a sequel to war. The need to combat the disease was instrumental in the development of the first veterinary school in 1962 in Lyon, France. It is a List A disease by OIE. Global eradication program started against this virus because it has a 100% mortality and was easy to eradicate because 1. It has only one serotype. 2. Infected or vaccinated animals develop lifetime immunity against this virus. 3. There is no vertical transmission, carrier state and vactor is involved in this disease. OIE has declared the world free from Rinderpest in 2011 and Pakistan free from it in 2007. Morbidity and case fatality. When an epidemic occurs, mortality reaches up to 100% and case fatality up to 25 to 90%. Methods of transmission. 1. Direct contact through urine, feces, nasal discharges and perspiration. 2. Indirectly through inhalation of fomites. 3. Aborted fetus of bovine may contain live viruses. Pathogenesis. European cattle breeds, like Zebu, are thought to be more susceptible to the disease. Virus enters the body through ingestion and inhalation, then enters the pharyngeal lymph nodes. Here they grow and multiply and enters the blood and cause viremia. Then virus go to the respiratory and GIT tract and conjunctiva and causes leukopenia followed by lymphoid necrosis. Virus shedding is continuous throughout the acute phase and subsides when body temperature return to normal. Incubation period, 3 to 15 days but mostly 4 to 5 days. Different forms of disease. 1. Per acute form, mostly seen in young animals. Their body temperature may rise up to 104 to 106 degrees Fahrenheit with congested mucosa, respiratory distress and death within 1 to 3 days. 2. Acute form, it occurs in young and naive animals which are not previously exposed to the infection. The disease occurs in 6 to 9 days. First stage of disease, called Stage of Prodromal or hidden fever, occurs after several days. Temperature may rise up 105 to 107 degrees Fahrenheit without mucosal erosions. Anorexia, drop in milk production. Then leads to inflammation of the oral cavity, buccal cavity and conjunctival mucosa and hyperemia of vagina and ulva. Lacrimation is more profuse and then purulent. Blueby salivation, cleared blood-stained saliva followed by purulent salivation and halitosis. Discreet, greyish-raised necrotic lesion on lower lip adjacent gums, cheeks and tongue and enlarged edematous lymph nodes. Severe diarrhea and dysentery occurs when lesion reaches the abomasum and intestine, which may lead to dehydration, fall in body temperature and death of the animal within 3 to 6 days. 3. Subacute form, affected animal show rise in body temperature to 102 to 104 degrees Fahrenheit, causes death of the animal in 2 to 3 weeks. Persistent diarrhea, loss of appetite and catarrhal inflammation of mucosa are observed. Necrotic lesions appear but heal during course of disease. 4. Atypical form, clear from its name, have no specific signs and symptoms. Affected animal dull, depressed and anorexic. Some animals may die but recovery in large number of cases. Post-mortem lesions. 1. When animal is opened, erosions, congestion and hemorrhage will be seen in the oral cavity, intestine and respiratory tract. 2. Edematous and enlarged lymph nodes. 3. In some cases hemorrhagic gallbladder. 4. Zebra stripings is pathognomonic lesion. Differential diagnosis: rabies, drop jaw, pouring, urination, salivation and swallowing in the animal. FMD, feet involved, ropey salivation but no diarrhea. Boulevard, causes abortion, lameness and nervous sings. PPR, affect sheep and goat. Blue tongue, cyanosis of tongue and coronitis. Vesicular stomatitis, also called pseudo-FMD, foot lesions and no diarrhea. Actinomycosis, involvement of jaw, hard tissue, animals can't swallow. Actinobacillosis, wooden tongue and soft tissue problem. Diagnosis, based upon clinical history and signs. Virus neutralization test, ELISA and RT-PCR. Prevention and control, slaughtering policy, quarantine measures, vaccine available. Animals are vaccinated after 4 to 6 months, then 21 to 28 days booster dose, then may annually repeat this dose. Thank you.